Good afternoon, everybody. It is March 7th at 1:15 p.m. So I just wanted to kind of visit with you and let you know how the surgery experience was and how things are going. I kind of wrote things down just to keep track. First of all, I am freezing already, and I haven't lost that much. I've lost a little, but I'm not telling you yet. I'll tell you that in a couple days. Anyway, so when I woke up from surgery, no, I didn't. No, I didn't. When I woke up from surgery, I have never had a surgery before, ever. This was my very first surgery ever. So I didn't know what to expect. I watched videos, and there were so many people that said, "Oh, it was a breeze. It was nothing. It was just a little tickle." So I wasn't really prepared for the pain afterwards. So when I woke up, I don't know if they don't give you medicine right away, or I'm not really sure. But anyway, I was in what I thought was extreme pain. I would say it was a 10. And I was, asking, please help. And he was helping. Poor guy. I kept seeing him. I was in a haze, but I kept seeing him, screwing in the syringes and pushing it in, and I would feel it. But what seemed like to me was a few minutes was probably a lot longer. But anyway, so they finally got me settled down, and they took me to my room, and I don't really remember what happened right after that. How long was I in the room before I woke up? Or was I awake when I first came in? Apparently I was awake when I first came in. So the first day was mainly about pain management. I did get up and sit in the chair. I did walk once. I probably should have walked more, but I did walk once that first night. They kept the pumps on my legs all through the night. And they kept the pain medicine rolling in, but it was hard because it was very painful, and I was really nauseated, and I don't do very well at all with like the flu and the stomach flu. But I can't handle that very well. So the first day was hard, but they kept telling me it's gonna get better, it's gonna get better. So then the second day, the pain was a little bit better. When I first woke up in the morning, I did feel better. And then after the doctor came in, I just kind of went downhill. And that's what she expected. She said that it was going to be kind of a roller coaster all day where I would be up and down and up and down. So we did walk some. Pete helped me walk some. And but the biggest problem was not even the pain. The biggest problem was that the second day, I was not getting hardly any fluids down. The fluids that I did get down would come back up. So I don't know how many times I threw up that day. Probably about 3 times, I think. But they were very violent. It wasn't just gagging. My stomach was so sore. So it was painful from the surgery. I was nauseated, and I was sore from throwing up. So let's just say if you're about to have surgery and you've never had surgery before. Now there's people that have had surgery before and they know what to expect and all that kind of stuff. If you've never had surgery before, just know in your mind that those first 2 days are going to be really hard. But everybody was so nice, and they just kept encouraging me. And I really, like I said in my video the other day, or, the little clip, I totally felt like a wuss because I was like, I can't take this. I don't. And that is not me. So, day 3 went very well. I was still in the hospital, but I did feel a lot better. Pain was around a 4. Nausea was not bad at all. The problem then with that day was trying to get enough fluids in that I could show them the progress of peeing and having enough fluid, so I wouldn't be dehydrated. So that actually took a while. I think she let us go just because we wanted to go home. But so I think we got home about 5 o'clock. So since then, it's been going very well. Oh, wait, hold on. I wanted to show you. Now, if you have an upset stomach or you don't like gross things, I'm going to show you a picture. So, fast forward or something.
She also has explosive farts.
Ignore. I will talk about that in a second. Okay, so they gave me this picture. I don't know how well you can see. But there's my liver. Right there. Right there. Right there. He said that apparently I did very well, that my liver was perfect size, and he had no problem at all. And there is my, let me see it. There is my stomach. Ah. So this, wait, that always confuses me. I have a hard time with that. This, I think, is the part they cut off, the big part. And then this is my little tummy. So, that we're now trying to please. And for any of you that have not had surgery, there's one thing that I did not expect. It talks all the time. I can't do anything about it. It just talks. So be prepared for that. I don't know if that'll change. I don't think it'll change because P had vertical gastric banding 12 years ago, and his still talks. So I assume that that's like gonna be a thing. So that was my pictures. Okay, so now, hold on. This is the most important thing. Right? Sip, sip. He's over there falling asleep. I'm putting him to sleep. So, since I've been home, have I done good?
Yes, but you have explosive gas.
So, they did tell me, and I told you guys this before surgery, that she did tell me not to trust a toot-toot. And that is very true. I don't say the F word.
What, fart?
Yes. Yeah, that's true. Anyway, so the most important thing, of course, at first is water. The very first day, all I was supposed to do was, I was supposed to start protein shakes the day after I got home, which I did. I got about 4 ounces of protein shake in. So today, yesterday I got up to 50 ounces of fluids and 32 protein. So hopefully, today this morning he fixed me a protein shake with 6 ounces of skim milk instead of 4. And I was able to get that down in about 30 minutes. So good. Maybe later on we'll try a full one. So just one day at a time, things are going well. I will admit, and he's going to get on me because he's hearing this right now, that I am probably not walking as much as I should, but I am doing like leg lifts and all kinds of other things. So, and ankle things. Shush. Okay. So phase 1 diet is what I am on until the 17th is when I go see my surgeon. And I assume he'll put me on phase 2. I'm on phase 1, which is clear liquids, with the addition of protein shakes and my multivitamin. And then phase 2, I assume I start my calcium, and then I can have like pudding and cream soup and all that good stuff, which will be very nice. Every day, just like they said, believe them when the nurses and doctors tell you. Every day gets better, because the first 2 days I was saying, why the heck did I do this? So, however, there is something else. I have been having very strange dreams, and I don't know if very many of you that watch our Food Addicts or know someone who has a food addiction, but when you cut back on the things that you eat, the things that you use for emotional eating or just things you enjoy, your brain and your addiction tells you, what the heck are you doing? So I've been having strange dreams. I dreamt that I was eating a turkey sandwich after Thanksgiving dinner. But the biggest one was I dreamed that I was a quality control person at a Lay's potato chip factory. I would stand at the thing and the conveyor belt and eat chips as they go by to make sure they're quality controlled. So that's kind of embarrassing. Okay. But I just wanted you guys to know, kind of, maybe if you go through that, I guess it's a normal thing. Let's see what else.
You gotta be running out of videos.
No. 10 minutes. Do you have anything to help people? Who are going into surgery, like something to expect?
When it's not love, wear a glove.
Can you be serious? I'm gonna edit that out.
The most important thing is chew your food really well, 20 to 30 times, and eat with a baby spoon and fork. Start to get used to it now.
Yeah. He had me try that the other day, and it was actually kind of difficult using I don't know if you guys heard him, but he said the most important thing is to chew, when you get to a more soft food, normal food stage, to chew your food really well. Yeah, soft foods too. Use a baby spoon and chew like 20, 30 times. I tried it with cottage cheese the other day, and it's kind of hard. It takes some practice to, because I'm used to just, and you're done. He keeps telling me I'm mentally retarded, but guess what? I just am who I am. If that's mentally retarded, I embrace it. Right? Right.
Sure.
Any other helpful information? Of course, the main thing when you first get home is water. Sip, 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 sip. So make sure you get yourself a nice cup that you are comfortable, sipping.
Just be careful passing gas.
You told them that already. I think that's it, everybody. I will make my week 1 update video on Monday.
Pass gas, have someone spray, because this thing's really bad.
You do realize this is going out on the whole World Wide Web, right? Okay.
And you have a flatulence problem? Yes.
You're such a brat. So I have lost a few pounds, but I'm not going to tell you how many. You're going to have to wait until Monday, and I will make a video then. So I love you guys. Thank you all so very much for your support. And if there's any questions that you have, I don't know, if there's anything that you're wondering, even just about me personally or anything, just holler. I'm an open book. Alrighty, you guys have a great weekend. We'll see you Monday. Bye.